Hey guys, I've got an opportunity today to talk more about Saxenda. So Saxenda came out recently. It was actually, the medication inside was an anti-diabetic medication to help with diabetes and reducing blood glucose levels. One of the side effects, which was fantastic, was a weight loss. So they've actually came out and put it into a medical device specifically for weight loss, and a few specialists have been prescribing this. There isn't a lot of information, and since it isn't out for a long time, there might be need for more support, and that's why we're doing this video. It's also an injectable medication, so some better injection technique can reduce side effects such as like bruising or irritation outside of injection. So that's why we're doing this here today. Another thing that confused a lot of people was it's 3 milligrams, and then you're putting in like different doses, but when you're checking this vial here, it wasn't actually moving along, and that's because you're putting really small doses in initially. So I'm going to show you here, if you're getting a brand new pen and you wanted to test that there is adequate flow, you can actually twist it to these dots there. So you can see there's a few drop dots, and if you press that, you will see a few drops come out of the needle. A whole section come out there, and every time you've inserted a correct dose, it will go back to 0. Yeah, so I'm here with one of our clients. We'll keep her face to keep the privacy out, but I'll change this needle cap to a new needle, and we can show you one injection technique. You can use this injection on your arm, on your abdomen, and on your thigh, upper thigh as well. And I always encourage that you change the location site systematically, and have a strategy of how you're going to remember which site you're injecting daily, so that you can pick a new site each time, and that the cell can process the medication, the cells can repair, and you're not getting just clumps of medication just in one area of your body. And I would actually write down a chart from 1 month, so you can do like say 1 week, 2 week, 3, 4, and then after that next month is thigh, 1 week, 2 week, 3, 4, another side of the abdomen, and change it around. Actually, realistically, you never do this because you're right-handed. You'd only go like 1, 2, 3, 4, but we can change that around and show you that there. So I've got a needle waist spin here. Put this back on. You don't need to swab yourself. You don't need to wear gloves when you're doing it on yourself at home. I'm just going to do that here for best practice in the pharmacy. So we change. Get a new needle at every injection, because what happens after you pierce it one time, this needle, although it looks really sharp, it gets blunt, and then if you don't change it, the site of injection hurts more, and then it's not as a clean injection. It's a brand new needle there. Just opening up. You get these needles for free as well when you have this, and twist it tight. And this one here, you don't go to the full dose straight away. You have to build up the dose. And so over the next few weeks, you'll slowly build up that dose. I'll get you to, you're on what dose?
0.6.
Oh, 0.6 now, no worries.
So they've advised 0.6 for the first week, and then go up to 1.2 for the second week.
Perfect.
Yeah.
And with the reason being is some people get really nauseous. Did you experience any nausea?
Not so far.
Yep.
Yeah.
Yeah. So we slowly actually build it up into the system so your body can deal with it. However, even at 0.6, you should find a bit of reduced appetite already.
Yes. Yeah. Definitely.
Awesome.
Yep.
All right. So I'm going to change the angle just right down this side. This is an injection technique that I show people for subcutaneous changing the sites. We can do it on the abdomen, and I'll show you here. Do you have a bleed when you inject?
Yes, I did the first time.
The very first time you had bled a little bit, because we can just give you a bit of tape. Alright, so you've got the 0.6 there, clean needle. You open it up, take off the needle cap. Okay.
So is this when you'd actually, because you've put a new needle on, you would actually put it to that little thing to check it?
You don't need to, because it was so. You only need to check it for the first pen.
Oh.
Yeah.
Yeah.
You can do it at every needle, but 100%. You can already see it's got a droplet there.
Great.
Saves you wasting it.
Yeah.
Good question. Other question people ask as well is, do you press it as you're inserting it, or do you insert the needle into the skin then press it? The best practice would be to insert the needle into your subcutaneous and then inject the liquid, and then just give it a click and it will go through.
Yep.
Okay, so which side is it? Yeah, if you stand up, that would be fantastic.
Yep.
And then, go on the side there. So with your skin, a great way to do it is actually to just pull the skin aside a little bit, because when the skin bounces back, I don't know if you can see that, when the skin bounces back, it'll actually plug it for you. And a lot of people think they have to pinch a lot. We've actually got a decent bit of fat on the skin already, so you don't need to. So you can pull it across, insert it in at 90 degrees like this. 1, 2, 3. Okay, it's in the skin now. Press, hold for 6 seconds. 1, 2, 3, 4, 5, 6, and then when you let go, you shouldn't have any.
So that's so just to let everyone know, that's much better than when I did it. Yeah. So I, by reading the instructions in the actual pamphlet, you sort of get this sense that you have to do everything fairly quickly. By watching you do it, going in fairly slowly, pressing it, and then taking it out slowly seems to have made a very big difference.
You'll see you won't have droplets of blood coming out.
No, it's nothing.
Yeah. And because you're not stabbing yourself.
Yes.
And you're just letting this needle, by the way, they use this in cosmetics a lot for rolling on the face and doing like skin therapy. It's really soft. It's almost like thinner than acupuncture. You shouldn't actually feel too much pain.
Yeah, no, there was no pain.
Oh, fantastic. Yeah. I'm really glad. Thank you for that feedback. So just small things like that can really help your whole journey. If you journey with your pharmacist, they can do measurements for you as well. You can keep that needle and change it next time. Yeah, actually should be fine, to be honest. I just throw the needles away because, as you can see there, it blocks and it covers itself.
Oh, okay.
Yeah, so if you take the needle out, it's not going to drip out or anything, because it's under a system where it will just hold itself.
Yep.
Yeah. So you can change the needle.
And you can see now that the red
you can
moved
see that it's coming up a bit
Yeah.
more as well. So it will keep clicking up and clicking up as you go along and as you're pressing it out. Maybe the first few times, because you're just using like 0.6, until you used it say 2-3 times, then it's going to go up and it will let you know. So about one of these will, depending on how your increments, when you get up to 3 mil, it would be a new pen already.
Yep.
Yeah.
And one of the biggest things when I first did it was that you don't see that go up at all, and you sort of get this sense that maybe it's not working, because when you read the pamphlet it says you'll be able to see it go up and you'll see that you've used some. So because you're only going up in small increments, those first couple of times you can barely see it, so you think, oh, have I actually, is it come out?
Yeah.
So what you do want to not do is actually do it again, because then you're going to get a double dose. Because that did cross my mind. Yeah. That's
all right. Yeah, a lot of people, because it's so small,
very small. Yeah.
They think, it's 0.6.
Yeah.
So it should just be tiny. You'll just notice it slowly from down here move up. And the other thing is they give you more so that you can do that.
Yes,
checking.
Yeah,
you can keep this outside of the fridge here, and then you slowly move up in your injection site. If you wanted to do your arm, I look in the mirror as well, and then I'll just have a look here, keep it straight, insert it in, click 1, 2, 3, 5, 6. Take it out and then move it around the arm a little bit, and then in your thigh is pretty good. When you're sitting down at home, you can just click it into your thigh. And I have a diary, like I have, if you don't know you do journaling, but I have a little diary and you write it in and you cross off which sites. And with any change in like medication, any weight loss, or anything we want to do improving and changing our lifestyle, 100% resistance. The brain won't like it. So I actually will get people to do like an awareness journaling while they're on a weight loss program, or any medication or health benefit you're trying to get out of it, and then weighing up like what are the changes so that you can sustain it later on too. Thank you so much for giving me the opportunity to demonstrate this. I hope it helps other people that are prescribed Saxenda for injection technique, and taking out some confusion what you might have. Was there any other questions that you think people might like to know?
No, probably just my initial confusion around the dosage. So the fact that it says milligram, and if you read the brochure, there can be confusion around the fact that you're really just putting in. So that whole pen could be the 0.6 for the whole pen. I didn't realise that. By putting it up, you're not going up in increments for that pen. It's actually just the dosage.
Just the dosage. Yeah. So it's just how much milk you're getting across, and as in into your body. That's right. And the other thing, I guess, too, was that it does say in the brochure that you keep them in the fridge, but my understanding is you can keep the actual pen out. Can't you, for up to a month? So the pen that you're using. The first time you're using it as well, I like to say get it down to room temperature, because when it's cold, it actually gives you a bit more irritation and pain. So this pen here, it's fine. You can keep it out for a month now that you're not using it. Now that you are using this one here. So.
And the other thing is, as I think I've already pointed out, was that I sort of did more of a stabbing approach, and that has caused quite a bit of bruising.
Do you mind if I just show you
a video?
So if you go really fast, and then I think a lot of people do think, okay, I need to get this into my body, they will actually, I'll take this off the stand, they will go like this and stab in, and what that can do is cause a bit of bruising there, as you can see. It's a bit light. You can see you can get a little bit of bruising there.
And you don't want that across the whole body. Frequently.
And especially when summer's coming up and you want to, get out and about, especially do your thighs. If you have the right injection technique, that can avoid a lot of adverse side effects there. So thank you so much. I hope that really helps other people as well. And I think other pharmacists as well. If you've got other pharmacy students that don't get a chance to have a look, this could be really helpful for counselling techniques and journeying with your patients. So thank you so much. All right.